and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, good afternoon, everyone, and welcome to this February edition of Healthcare Quality and Risk Matters. My name is Gary Bierce. I'm the CEO of Aperitisoft Healthcare, and I am joined by my esteemed colleague, Rob Santamore. Rob is our Chief Operating Officer, and we are excited about this month, right, Rob? Because we're doing something we've never done before, and you're really zooming in on me there. But
I think my computer is glitching.
It's zoomed in and out. But we're going to be talking about behavioral health this month, and we've been talking about it as internally as a company for a while. That this is a segment of healthcare that often people don't think about from a quality and risk perspective on having the best practices that are seemingly being attempted by general hospital operations or in other aspects of healthcare. So, Rob, you're bouncing around like a ping pong over there. But so, Rob, what are your some general thoughts about behavioral health and quality and risk? And by the way, everybody, we want to full disclosure. Neither I nor Rob are behavioral health experts. So this is new to us. So we are planning to do something new today in our show. We really need your help on comments and questions in the chat. We're going to be turning the table to you, the audience. We had over 750 people sign up for today, so we're hoping we have a lot of active participants during the show. But as we're getting into different concepts, we may be throwing questions to the audience because you're the experts this time. You're the folks that are in this field, not us. And we are really curious and concerned about this. So before we get too far, why don't we have Rob just kind of give us some of his thoughts? He is our registered nurse. And some of the things maybe you've experienced over the years, Rob, something that kind of tee us off.
Yeah, so I was really thinking about this topic and wanting to talk about it, and off of what you were saying, Gary, with there's not being an expert in this space, and then thinking across my 20 years of experience in healthcare, there's why do I have such little experience? Why do I have such little exposure to this space? There's when I can, although I've never worked mother baby, I've never worked there units and not know the nuance of their roles. But in general, understand clinical application of their work. But then you take behavioral health. And I have such a practice deficit. In that space because I don't think it gets the attention it deserves. I don't think it gets the attention it deserves in every aspect of healthcare, whether it be as a collaborative partner, otherwise
very interesting,
providing care in the hospital. Or even through there's access to care, right, in the community,
and we really should, right? I mean, I know our producer Jason gave us some statistics to throw out at the audience that in the year 2022, 4.9 million commercially insured adults under the age of 65 had a diagnosed mental condition, which is a 23% increase over the last time that was recorded, which was in 2018. I mean, that's a lot, right? That's a lot. That's a big increase. Looking at the National Survey of Children's Health data briefs on adolescent mental and behavioral health, this is looking in October of 2024, the prevalence and increases of diagnosed mental health issues between 2016 and 2023, they're showing that there is an increase in diagnosed anxiety among adolescents increasing by 61%, Rob, and depression is up 45%. And then when you look at gender differences, 20.1% of females had the diagnosed anxiety versus the 12.3% of males. And then among adolescents with current diagnoses who needed treatment or counseling, it's a 61% had difficulty getting needed treatment in 2023, and 35% increase since 2018, with a notable rise after the year 2000. So obviously we've got a real increase in behavioral health issues that need addressing, right? And it's going to continue to go up. So we've got some comments. Reverend Jody Suzanne, 80% of employees are looking for help with their mental health and want their employer to help. I have that solution out of the box. Okay.
I like the awareness that comes from the increased data capture, right? So trying to think about, there's that escalation in like epidemiology in biostats. Is it because of we're becoming more aware? And if that's the case and we're getting better at diagnosing, I think that's wonderful, because then we're able to capture more people in need. But if that is the case, and 60% of those people are not able to find adequate care,
that's
then we're not, either way, we are facing a deficit. If we're getting good on one side of identifying the need, we're not getting good at treating the need.
Well, the thing is, in healthcare too, both disciplines still are having staffing issues.
Oh, absolutely.
So if you're increasing with issue and our staffing is down, we're putting patients at risk.
Definitely. When you can't provide care, there's whether it be inpatient or post-acute care, there's I know projects that I've worked on for 7-day, 14-day, 30-day follow-ups, post-acute care for people with mental health, substance abuse disorders, you name it. There's just trying to get well. There's so many providers cannot or will not provide care for those people. And a big part of it is we don't know how. We're not educated. So
Right.
We have a wonderful question in the comment about young healthcare quality professionals interested in behavioral health safety. There's what competencies can help develop early. One, I always run back to the basic blueprints, right? Knowing OMH standards. But two, spend time. There's Gemba round, right? Gemba is one of our favorite words to capture data in the system space. There's in Gemba, there's talk to the experts. There's spend your time in the book, the textbook, the standards. But don't use that as your only evidence.
Well, let's maybe, Rob, we should hone in on the fundamentals, the basic blocking and tackling of quality and risk management, okay, for healthcare. One, we know in hospitals alone, proactive risk assessment is not common. So we can assume that proactive risk management assessment is not happening in behavioral health, correct? Incident management, which is becoming, it's mandated in general healthcare. I would assume it's now fully mandated in behavioral health as well. And this is where we're identifying incidents, properly triaging them, analyzing them, determining root cause, and then making a quality-based decision on whether a corrective action or preventative action plan needs to be implemented so it doesn't happen again.
Agreed.
Okay. And then maintaining that data in a way that you can get proper analysis on trends, on changes, and obviously to monitor improvement. I mean, that's something that needs to be in place. We need to manage the regulatory compliance side of this, get ahead of audits, right? Making sure that we are managing things according to what the regulations say. But if we're doing things the correct way, Rob, and I'm going to throw this out at you, even in behavioral health, we should automatically be complying with regulation.
Yeah.
So if we're going through these self audits, it's really to find out what we haven't done yet, right? Or maybe are there some other little things that the regulators want us to do? But it shouldn't be like a major exercise that we're figuring out how to be a quality management program through regulation. That's the wrong strategy.
I fully agree. And I actually think that you answered, and I hope that I say this name correctly, and correct me if I'm wrong, Cynthia, your question about how to start with your competencies early. I would take what Gary said and do proactive risk assessments, which will help you in your Gembo rounding to capture the application of the standards. That would be my biggest deficit. So somebody who's been doing this for over a decade, how do I apply the standards? How do I make sense of it? And how am I assessing my risk for nonconformities? But most importantly, how am I assessing there's the safety of my patients, not understanding the protocols of how they're applied. So those proactive steps are going to be paramount. There's for you to be able to truly understand there's your space.
So in our newsletter, we had some, we had some main points of discussion. One of which is behavioral health from a quality and risk perspective being treated differently? And we threw a question in there. Are we protecting patients or are we protecting outdated systems? So I'm going to throw that out to our audience who are experts. Is it possible that because we've always done it this way, I'll put the quotes.
I hate that.
Right, yeah. We've always done it this way, that there are systems being applied in behavioral health that need to be updated, fixed, revised, and completely overhauled into a more modern system. So I think the question in the newsletter, which our team said very concisely, who are you really protecting? You're trying to protect the patients, or are you protecting something that's outdated? So I'm looking for comments from our audience on that one. While we're thinking about that, Rob, what are you, in your mind, what do you think as a nurse would be some of the big incidents that would be happening in behavioral health?
I think, so the biggest things that I faced as a bedside nurse were our patients that were struggling with suicidal ideation. And how to protect those patients. There's the best. And I also think of assessing risk. There's when they are in the community on their own. Thinking about discharging my patient that I knew had struggled with those very terminal thoughts in their brain, and knowing that they're going to get discharged probably in the near future. That's a very terrifying thought. And I know that I need to trust my team of healthcare mental health professionals. There's to ensure that risk is appropriately monitored, that there's good safety strategies in place, that there's good care systems in place to help the patient be safe once they leave 24/7 care. But being able to capture, did we do a good job with that safety assessment? What was our risk assessment for that patient? What did that look like? What is other evidence-based practice? What are our scoring systems that we're using to assign data to that to say, yes, this is truly safe?
Help me understand, Rob. So what you're saying is that, okay, we have an incident that has occurred. Maybe it was an attempted suicide or something like that. That should drive through to a CAPA. In that CAPA, and in particular the preventative side, a new protocol should be put in place, where there is a risk assessment of that patient before they're moving on to next steps. Now, I'm assuming that in most well-run behavioral health organizations, that's already happened. So if it continues to be a problem, what does that tell you as a quality professional?
Well, one, you're reactive, and two, you are not reacting in a preventative way, right? You're not thinking through the full process. You're not doing a very good comprehensive assessment, capturing all of the right people to ensure that all of the right controls are in place and that you've assigned the new best practices, and that you are maybe even not assessing the risk at all. Yeah. And I think that actually leads into another wonderful question from Cynthia. about leadership strategy, what leadership strategies are essential to shift behavioral health from a reactive incident management to a proactive standpoint.
Well, wouldn't that be the same? Wouldn't it be the same strategies as general healthcare?
It would be, and I would argue that culture would be the most important thing.
Yeah, we always say that. Yeah.
Yep. And one of my favorite podcasts and favorite things to talk about is the culture around quality habits. There's who as an organization you are and who as a practitioner you are. So the leadership strategies are adopting. There's a culture of high quality, high reliability. There's risk reduction. There's in compliant processes that are patient first. And really a full 360 view of everything that's happening, and being proactive. Exactly.
And we always say that if you're managing quality and risk properly, you're managing your business properly. So therefore, good quality and risk management is good business. And it's important for senior leadership to understand if they connect the dots properly, not only are they going to get better pay-ins, right, from providers, but they're also going to be reducing cost that is also affecting their business and their ability to reinvest into new technologies. So taking an emphasis on being proactive with your quality and risk management leads to better profitability for the hospital. So I think one of our shows,
good quality is good business. To your words. Yep.
Yeah. So I think one of our shows in the past, we were talking about it. Everyone's worrying about funding. Where are we going to get money for this new wing or for this new piece of equipment? Well, if they really focused on quality and risk properly, that's your source of funding. I mean, we have seen in general hospital care that the cost of poor quality can be upwards of 15% of receipts brought in as revenue in these hospitals. And I know you have said there are some hospitals are worse than that.
Significantly, which is terrifying and horrifying at the same time.
Yeah. So getting focused on the right things and keeping that attitude that we want to provide the best care possible, and we want to put in protocols that are going to assure that the best care is going to be developed and continuous improvement around that care is part of how we do business, changes everything.
Oh, I completely agree. And I think that even leads into our next two comments. The next comment is about some of the biggest risks that they're facing in the behavioral health space.
Sexually acting out. I could see that in behavioral health. Yeah.
Such as sexual behaviors, workplace violence, and unanticipated deaths. Knowing some of those largest concerns in the space for patient safety, as well as staff safety, right? Workplace violence, that sort of stuff. And then this question about how analytics or real-time monitoring systems support proactive behavioral health risk prevention. And it's just that it's investing in the right programs, the right systems that are smart enough, that are comprehensive enough, that pull all of your data into smart dashboards that let you do everything from making large-scale decisions about what wing you're going to open next. There's what are my needs, greatest patient risks.
Yep.
There's to honestly, where am I going to shift my people today? There's during your daily bed assignment, I can look at my quality, risk, and compliance dashboards and say, you know what? I've had a lot of support needs in behavioral health. There's this last week with increased number of behaviors, as was pointed out in the last comment. We have 2 floats. Let's send one to the emergency department and one to behavioral health. Right? You can help resource allocate. There's based on good data that helps you staff appropriately. There's get the support or system or software or device there's necessary to appropriately monitor your people, right? Your patients, do they need a camera in a hallway? Do they need different doorknobs or toilets or shower curtains because there's known risks with those things? collecting data from both your internal systems, and outside best practice. And running it through there's self-administered assessments that are proactive, helps you provide better care, safer care. There's better hospital metrics, meaning better patient outcomes, and it's better business.
Yeah.
It was a very long answer. Sorry, I could keep going.
It was a good answer. It was a good and pointed as well. And Sandy, the question is phenomenal. And I'm sorry we're going to be answering it from a lot of different angles. Systems are everything. Okay. Yes. So if you're going to have data analytics, you've got to have systems that are gathering the right data and building the right kind of database so that you can grow and evolve with it. So everybody's talking about AI today. But one of the great ways AI can help is to have a properly structured database that can be evaluated and see what new types of things are in there. Now, those real-time systems that Sati was talking about, they're game changers, right? I mean, they can tell and predict when somebody is looking anxious and maybe thinking of suicide. They're using it in senior living today to look at the gait of some of the residents to see if they're getting ready to fall.
Mm-hmm.
I mean, so these are major prevention systems that can be placed into any organization, healthcare organization, to prevent a lot of the worst incidents that are reoccurring from happening. It makes a lot of sense. So we got is it a question or a comment from Monica Dowling?
Kind of both. That behavioral high-risk residents, there's really are impacting care of other residents, right? And one of the key patient rights across all aspects of healthcare is the right to safe care. It's worded slightly different than that, but that is what it means, right? Knowing that there can be patient-to-patient violence or patient-to-patient disruptions. There's somebody with the behavioral health need, and causing disruption, they themselves are in a disruption they deserve care, for that. And then the person that is being disrupted, also deserves safe care from the disruption, right? So being able to capture data about where am I locating these patients? On this wing, I'm having a lot of these types of disruptions. I don't have the right staffing. I don't have the right protocols in place. There's my risk events. There's when I'm sending them through the peer review process, we're identifying that there's assessments like the gait assessment you talked about for fall. There's this one, behavioral health. There's our behavioral health. There's scores for X, Y, and Z indicate that we could have predicted this patient having that outburst that then impacted them and another patient. And we could have and should have prevented that. Then you can adjust protocols, you can adjust training, you can adjust staffing. You can even adjust your budget, right? Based on what you need and where you're allocating patients. And I think it is so important to be looking at these exact things that many of our listeners are pointing out today. There's to be proactive, to have good assessments, to have smart systems to do it. And to consider all of these things in acknowledging that there isn't the support out there today that is being used.
Let's look a couple of other hot topics we mentioned in our newsletter. Compliance and oversight hotspots. If it isn't documented clearly, it didn't happen when it mattered most. You've always said this, Rob. Whoever has the documentation wins.
Every time. You can have done everything 100% perfectly. But when you're sitting in front of an auditor or an attorney or a judge, and you do not have something in black and white on your screen or on your desk, and you're going to then take the word of the patient versus you, the patient's going to win. And
here's another one for you. How about restraint and seclusion, right? Are restraints being reviewed as safety events or treated as routine care?
So I feel every organization today should look at their safety protocols around restraints and seclusions. And try to figure out a way to map them to best practice and what is practiced. There's because I bet there's not good data within their internal organization that has good assessment that say what really is happening. And they're going to find out through a risk event with the patient where somebody has a negative outcome because of being restrained, either chemically or physically. Or they're going to have something happen during an audit finding. Both are bad outcomes.
Yeah, risk management, we look at these things as kind of part of the causal chain, right?
Yeah.
So often we react and we think we're putting together the appropriate response to an event. But in effect, we've just now branched off and created a new pathway for another risk. So understanding when these things need to be appropriately applied is critical.
Yes.
Otherwise, you may be creating more risk and therefore raising more cost in the organization.
And creating more burnout. Because I love this comment. There's traditionally, and I forget the statistic off the top of my head, but organizations of lower quality, higher risk events, higher preventable risk events, there's, and just in general, poor safety practices have much higher burnout, higher frustrations. There's higher staff turnover then compounds it, right? Creates more turnover itself, creates more risk events because newness creates risk events because you don't have the experience.
Yep.
There's so how can burnout among behavioral health staff impact patient safety? There's just that. There's your patients are working in an under-supported space. There's under-supported in many areas, including quality, risk, and compliance. Although highly regulated, in what strategies work best, that is having a quality, risk, and compliance presence. And taking the time to understand. And having systems that help give feedback, right? They need to know that they're being heard. So the data that's captured, what are you doing about it? Rather than just responding and being like, I didn't really like your seclusion report that you sent to me, and just sending it back to them. There's being highly engaged and having a culture around, there's continuous improvement. There's based on proactive risk assessment. There's based on incident management and best practice application.
Yeah. We have somebody who's made a great expert comment there about best care. Do you see that one, Rob?
I do.
For every event I think is what they're talking about there, every incident.
Every event there's of restraint and seclusion should be reviewed. Completely agreed. Period, right? Immediate needs addressed, trends reported in quality and safety, and then used potentially to ensure that all there's restraint and seclusions are appropriate for all care. There's handled with proper de-escalation techniques. And includes trauma-informed care and potentially lowering the number of events. I couldn't agree more. And I think that goes into the prior comment about using data. You can't get data on these types of things when you are reviewing it just when it didn't go well.
Yeah.
All of these things need to be determined to be appropriate care, or you missed a step. Your approach to the patient wasn't appropriate and you escalated the situation. You applied the restraint too early without bringing in X person, right? And I'm not going to pretend to be the application expert here. But basic quality, risk, and compliance says that these types of events, if you restrain somebody and they shouldn't be, that's a sentinel event. That is a never event. Yeah. You cannot do that. It is not okay. And everything needs to be, all of these types of events need to be reviewed, good data captured from it, and learning from every single one.
Now, you and I know we've been talking to a lot of people in behavioral health, particularly this last month, trying to understand a little bit more about what goes on there. And just about everybody we talk to says they have some form of an incident management system, but that it's fragmented and disconnected from how each event is properly triaged. Every organization's different. Some have the system automatically report every single time when an incident occurs. So the quality then has to do their triage on every single one. Well, when we're dealing with burnout and dealing with things of that nature, if there are hundreds of incidents that are coming in, that's going to be difficult, right?
Doing it, especially doing it on literally like a post-it, right? Like,
Yeah,
and I don't
exactly.
mean to say that, but it happens, right? Like clipboards, blue cards, pink cards, there's orange cards. I've seen different color coding systems for paper and pen.
To give a little plug for us, right?
Yeah.
And for the folks that are listening out there, we not only handle incident management very well, but we're triaging each incident as it's being reported. So the quality not only gets notified, but they're also given a triage score of how important it is for them to respond. So they get every single one reported back to them, but they're also alerted based on how the triage determined that incident when it occurred. But then within the same system, we have completely and seamlessly integrated the reporting of that incident all the way through to the corrective action planning that needs to be put in place and monitoring the completion of those actions so that you can have an overall quality score that can be monitored through time. So in a way, we're giving a near real-time monitoring of overall quality of the organization on how they're handling incidents throughout the year. So that's one thing we have in the system. Second, because our system was built on a risk management platform, we tackle audits and proactive risk assessments. We can even quantify those risks in dollars terms so that management can have a better understanding of how to prioritize and to make sure that all contained in one system. So it's easy for everyone to manage their quality risk. We include a document control module so that you can manage your versions of your policies and procedures. And it's all in one place and very easy to use. So I'm going to put that out there to the behavioral health folks that may be using different types of systems. If you're looking to try to get it integrated into one platform to do all these things and give you all that data that our comments were coming back, that proper data, consider Aperitisoft Healthcare. We'd love to hear from you. If you'd like to talk to us about that, you can just go to that QR code in the upper left-hand corner, and we'd be glad to pick up a conversation. If anybody out there just like to talk to us just from a quality and risk perspective and looking for some advice or direction, we'd be glad to talk to you. We've got lots of materials we can supply, and we'd be glad to help you out where we can. We'll stick around for a little while longer. Are there any last questions or comments that we didn't cover yet, Rob, that we need to before we say goodbye?
I think that there's either directly or indirectly covered all of these wonderful comments that came in. And I can't say how much I appreciate all of this. There's engagement around this space. It is a growing area of need, obviously by the statistics that you shared. And I do not feel that in the healthcare sector, we are growing in our ability to support. So we need to make smart decisions. As a healthcare system on how we're going to support everybody. And that is making data-driven decisions. Frankly, just investing in quality and ensuring that everybody gets the care that they deserve. I see a couple
questions coming in here at the end.
And how can incident reporting systems in behavioral health be strengthened to capture near miss events? There's support proactive risk prevention. So start with the cultural expectation that then turns into quality habits of reporting all of the things.
Mm-hmm.
What makes it easy to report all of the things, say using our system, is the triage part that allows for you to not get inundated. There's with near miss events that have not been where you don't have near miss events. There's your reportable events where somebody's unsafe. Allows you to aggregate all of those near misses. There's in a committee meeting or a quality ops meeting, or your daily huddle, and make smart decisions around trending data. So you can see there's changes happen from near misses that then prevent actual risk events.
So yeah, I mean, I think the way you did, Sandy, you need to think about this is that we use a term called bow tie analysis. You may be familiar with it, Sandy, but when near misses happen, what that means is the response side of the equation that deals with post event is working very, very well, right? So event almost occurred, but it didn't really, right? No real effect on the organization. So that means those controls, those responses, mitigation strategies are being very effective. But that might tell you, those near misses might tell you that maybe we need to be a little bit more proactive about prevention. Because if it's happening a lot, even though it's a near miss, that means that maybe there's some other things that can be done so that even the attempts aren't happening anymore. Mm-hmm. So that's how it turns the table to make it more proactive. And you want a really good incident reporting system to do that. Not all are going to help you with that information.
There's my favorite example of this. Is a behavioral health wing of a facility that I was working at when I was bedside. There's the side door. There's to the behavioral health wing was never fully closed. A lot of the staff would go in and out to take a outside break. And they would leave the door open. You know what? Nobody ever put in an incident on it. Nobody ever eloped from that door. Until one day they did. Thank God that patient was found safe. It did not turn into somebody getting injured. Right. But during even quality rounding at that organization, they would note that door was propped open, and they would just kick the rock out of the way and let it close and say, meh, nobody got out. It was fine. Your job as the healthcare facility is to protect those people.
Yeah.
That means putting in every possible risk to those patients. That was a near event. There's an actual event because you broke protocol.
Yep. Well, what a show, Rob. I mean, this is the first time we attempted this topic. I know there is Behavioral Health Month. We might want to visit this topic again throughout the year. Love to hear from you. If you would like to be a guest host in this topic, and your organization will let you do it. That's always been a challenge with healthcare. Attorneys don't like it when you get on podcasts, but we'd love to talk to you about that. Please, again, hit the QR code and reach out to us. Folks, we are just tickled pink at your support. We've been growing. I think we had over 700 people sign up for this podcast. We had over 900 last month. And we just feel the love, and we appreciate it. Please keep sharing this podcast with your friends, colleagues, and so forth. We really appreciate your support, and definitely keep giving us the likes that only can help us with our outreach. Our goal is to try to improve patient outcomes throughout the healthcare system through better quality and risk management. And we feel like you're joining us in that mission. And we can't thank you enough. Any last words, Rob, before we leave?
You said that perfectly, Gary.
Oh, well, thank you.
Yeah.
Well, everybody, we'll see you next month. Next month, we're talking about patient safety. And we're not going to disclose yet, but we may have ourselves a great guest host. So be on the lookout. This could be a really good show next month.
Very excited.
Right. We'll see you then. Bye now. Thanks all.